Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Today's generation of children, you got a couple at home, or adolescents at home, well, they're growing up absolutely immersed in media. From TV and video games to smartphones and social media, there is the possibility, actually, of 24/7 screen time.
I don't want to hear about it.
Well, of course, the media landscape is constantly changing. But what hasn't changed is that parents do play an important role in helping kids navigate the media environment.
Last fall, the American Academy of Pediatrics announced the new recommendations for children's media use. And here to discuss is Mayo Clinic pediatrician Dr. Nusheen Ameenuddin. It's nice to meet you, Dr. Ameenuddin.
She said it rhymes.
Yeah, well, thank you so much for having me. I appreciate the opportunity.
Now, you serve on the executive board for the AAP's Council on Communications and Media that wrote those guidelines, so you definitely have a good grasp of what we're going to talk about. But here's what's interesting about this. You call yourself a tweetatrician, so you
Yes.
are immersed in social media, too.
That is so true. And I have to say, it's one of the hardest things to make recommendations like this and also try to follow them to some degree to be a good role model. As a pediatrician, I don't have children of my own, but that is one of the big challenges that I know parents face.
You have some children around, so you figure out how big a problem this is.
The struggle is real.
Yeah, absolutely.
Definitely.
So, tweetiatrician, how did you get that title?
So about 3 years ago, Sunday was my Twitter anniversary, my 3-year Twitter anniversary.
Well, you're part of the problem.
Apparently, yes. Well, actually, this was around the time that Mayo Clinic was encouraging staff to join Twitter, to have a presence on social media, most importantly, to promote good information, to be a countering force for misinformation, vaccine myths, other things, and also to promote the institution and the work that we do here, which is wonderful. So at the time, I was very, very social media averse, having been part of the Council on Communications for a few years and being worried about the effect that social media and other forms of media had on children. So I very reluctantly created a Twitter account 3 years ago, and it laid dormant for the most part for a good 8 months. What ultimately spurred me to get more actively engaged in Twitter was the Disneyland measles outbreak in California 2.5 years ago.
Ah, interesting. So that's where you first started tweeting away.
Yes, absolutely.
So you said that you're concerned, or there's worry about the effect of social media on kids. What are you worried about?
Well, there are a couple different areas that we worry about. The big one is just that when you are sedentary, spending time in front of media, whether it's passive or interactive media, it displaces time that would otherwise be active time, whether it's doing chores or being outside playing, participating in sports. So we worry about a known correlation between screen time, sedentary activity, and increases in body mass index for children of all ages. The other things that we worry about more with social media are safety concerns. One of my emeritus colleagues, Dr. Dan Broughton, who is really a legend in the field of child abuse and neglect, had pointed out that really a number of children run into situations online where information is solicited from them, and sometimes children, being trusting or being unaware of what potential dangers are out there, can share a little too much information. So we worry about that as well.
Because I've got a kid who is no doubt going to end up to be a lawyer or a politician, I don't know what he's going to do, but he says, and again, 12, that a lot of this we don't really know. And you're assuming, Mom, that it's going to end up being bad, the effect that all of this social media and that screen time has on kids. And we don't know that it is. And I want to just trade him in.
Yeah,
Come on.
So it's hard to argue against that, isn't it?
That's true. So what is the research, because he's not here to ask this, what does the research show? I mean, how long do you think we're going to have to study the effect of screens on kids before we know for sure what to recommend?
Well, we actually have a pretty robust body of research over 30 years.
Thank Thank you.
That has shown that traditional media, which we consider television, radio, that type of thing, does have an effect on children's health. What we have less information on is how interactive media can contribute to that. So it sounds like you have a very savvy young man on your hands.
Serenity now. All right, so let's go through those recommendations from the Academy and start with little babies and toddlers. What do you recommend?
So I should give you a little bit of background first. In 2011, we had come out with our very first policy statement for media use in children under 2 years of age. That was right around the time that iPads hit the market. And so, as you know, I'm sure, research tends to lag behind technology development. And so we had gone with the recommendation at that time for no media use, no screen time for children under 2 years of age. But then, just in a matter of a few years, this whole interactive app business exploded. And so we had to take that into account with our new recommendations that came out last fall. What we know is this. Number one, the most important source of interaction for children, especially young children, is parent-child, face-to-face interaction. We know, because we have good research on that builds connections in the brain. That helps children with language development and other forms of cognitive development. We know that traditional media, passively watching TV, can be damaging to that. We also know that that certain series that claim to be educational actually have the opposite effect. And we really haven't found any significant benefit for screen time in children under 2 years or 18 months of age. So
no screen time? Is that what you just said?
That is generally our recommendation, but there are a few caveats.
Okay.
So we finessed the recommendations a little bit
to fit in with what people really are doing with screen time.
Well, yes and no. I think that the substance of the recommendations remains the same, which is that we want to limit screen time. It shouldn't serve as a babysitter for children of any age, and that parents should engage actively with children, particularly if they're younger children. The caveats we did make, though, is that if you're Skyping with a grandparent or another parent, or just anyone, that's fine. We don't consider that screen time per se. That's interactive. And there's actually evidence to show that children as young as 24 months of age can learn words from video chatting with an adult. The problem, though, is we don't have a lot of good evidence one way or the other. And so, again, we've finessed the recommendations a bit to take into account the real life situation that children starting from early infancy are just saturated with media, but we still really, as pediatricians, want to recommend what's best for children and what's ultimately best for development.
When these recommendations came out last fall, what struck me was the babysitting part of it, that if you are sitting and watching with your child and talking with them about what they're seeing, that is it almost a good thing?
That is what we recommend. So we still officially recommend no screen time, aside from video chatting, for children under 18 months of age. From 18 to 24 months of age, that's where the finesse comes in a little bit. If parents want to use interactive apps or do something more with children, we found that there's a benefit to them watching with children and this is the key point, reteaching afterwards. There has to be that interactive component. Otherwise, there's very little, if any, educational benefit.
Okay, so what after the age of 2?
After the age of 2, we actually broke the guidelines down a little bit. So under the age of 5, 0 to 5, with the caveat of kids under 18 months of age, we've really said, we've actually gotten more strict. We've said no more than 1 hour of quality television a day. What's interesting to note here is that you really have to be careful about programs that are billed educational versus those that are not. And I always recommend Common Sense Media as a great resource for parents to find out what's good. So actually officially from 2 to 5 years of age, we now say no more than 1 hour of high quality educational content. And we do recommend co-viewing.
What is Common Sense Media?
So it is a nonprofit organization based in Northern California that provides ratings, both crowdsourced as well as from experts who are part of Common Sense Media for a number of different video apps, television programs, movies. So when parents are looking at a movie that has come out in the theater, they might say, is this really appropriate for my 5-year-old, for my 12-year-old? And I find that it's been a great resource.
All right, after the age of 5 to 18. What do you have in there?
Okay, so this is another place where we've finessed our recommendations. The old recommendations were no more than 2 hours, hard line in the sand. And again, it's not that we have abandoned that. We still recommend that. We just have put it into context. Actually, I should mention that the American Academy of Pediatrics on healthychildren.org has created the Family Media Use Plan, which helps parents put all of this into context. And what it does is parents can log on and they can personalize media plans for every member of their family, including adults. So, if you're going to ask your child to stick to it, we have to also stick to it. But what it does is it looks like there are this many hours to sleep, there are this many hours of school, this many hours for sports or chores or other things. And so technically, while we're not saying less than 2 hours, it ends up being less than 2 hours when you take a child's other activities into context. The big message that we want to say, that we want to put out here is that we want quality media content, and it should never displace sleep, schoolwork, or other important things that kids should be doing, including unstructured play, playing outside.
Now, Tracy can attest to this, but your committee is aware of how difficult it is to police or enforce this, correct?
Absolutely. A majority of the members on the committee have children of all ages, and so we tend to be somewhat media savvy as well, and we have to turn off our devices during meetings. So yes, we recognize that it's a challenge. Everything, I think, is a challenge in today's world, but our job as pediatricians is to give parents the best possible information, understand what's practical, and help guide parents to make those decisions.
You really got to take the device away, right?
Actually, that is one of the things that I recommend. I think it's totally appropriate, and one of the things in our earlier recommendations is to have a device curfew. So at a certain point in the evening, you just power down and leave the device out of the room. And for many, many years, we've recommended not having any sort of screen in the child's bedroom. That has been associated with decreased hours of sleep.
Including television?
Including television.
All right, there's the latest recommendations from the American Academy of Pediatrics and Mayo Clinic pediatrician, Dr. Nusheen Ameenuddin. We got to take a short break.
When we come back, we'll switch gears and talk with Dr. Ameenuddin about another area of expertise that she referenced, the recent measles outbreak.
Hard to believe, isn't it? You're listening to Mayo Clinic Radio on the Mayo Clinic News Network. Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
We are back talking with Mayo Clinic pediatrician, Dr. Nusheen Ameenuddin. It does sort of rhyme, doesn't it? And we got to switch gears and go to a different topic, maybe something a little less controversial, but nonetheless a hot topic and a difficult one in a way. And that is the recent measles outbreak, including right here in the state of Minnesota.
According to the Centers for Disease Control and Prevention, from January 1st to May 20th, 100 people from 11 states were reported to have been diagnosed with measles. Measles is a childhood infection caused by a virus, and once quite common, it's now prevented with a vaccine. So, Dr. Ameenuddin, this is what you said when it happened to Disneyland, why you got involved in social media in the first place. So these outbreaks are what we hear about more often now, isn't it?
Yes, that's right. One of the reasons that I got involved on Twitter is because I noticed that there was incorrect information being put out there. It's something that I face almost every day, or at least weekly in clinic, dispelling myths about vaccines. And unfortunately, when you get to a certain level of non-vaccinators, you start to see these outbreaks, sometimes in pockets in communities like we're seeing now in the Minneapolis area.
Non-vaccinators. So, I mean, everybody sort of has felt that measles is a thing of the past, sort of like polio, that we've cured it, it doesn't happen anymore. And because of that, people become complacent. Is that the main reason that they are not having their kids vaccinated?
I think that's a big part of it. If you ask people like my father's generation, he saw his brother actually get stricken with polio back in India, and he was one of the lucky ones. He survived, but he's partially paralyzed as a result. And literally a couple of years ago, I had the mother of a patient who I was trying to encourage to vaccinate her children say, polio isn't really that bad. And And so I think the truth of the matter is that vaccines have been a victim of their own success. They're one of the most amazing public health innovations we've had in the last several decades.
So tell us a little bit more about measles. Obviously, you can prevent it, and almost always with the vaccine. But number one, you don't want to have your kids sick. But there are also some complications of measles, right?
Correct. So I will say, after you've gotten your second dose of the measles vaccine, we estimate that probably it's 97% effective. I've even heard higher things. Measles is incredibly infectious in and of itself. So if you have a room of 100 people who are not protected, if one person with the measles comes in and coughs, 90% will likely get sickened with the measles.
Really?
Yeah.
And doesn't that germ live for a long time after the cough?
I believe so. Yeah, I don't know the exact, but
that's what I've heard.
It's one of the most infectious viruses we have, and so it's a very big deal. And you mentioned at one point in time, people just got the measles and it seemed like they recovered and it wasn't a big deal. But actually, we find that when we start getting into 1,000 people infected, we start unfortunately seeing deaths, and we start seeing much more serious side effects like subacute sclerosing panencephalitis. Which
So
is
that sounds bad. That's something
it's
with
bad.
the brain.
It is with the brain, and unfortunately, it is fatal. There's no cure for that.
Really?
Yeah.
Normally when you think about the measles, you think about the rash and the fever,
Correct.
right? And that's what most people have, and they might have a headache and they get better. But not necessarily.
Not necessarily, and there's oftentimes always a cough associated with it as well. And so what we're seeing, so as of last week, as of the end of last week, we had 77 cases in the state of Minnesota, which is more cases in the last 2 months than we've had in the entire United States in the past year. About a third of those kids have been sick enough to require hospitalization. The more common complications of measles that we see are pneumonia, dehydration. We've literally seen kids on vents up in the Twin Cities. They've
On vents.
on ventilators. These are kids whose lungs have been so severely affected by the measles virus that they have had to be intubated, to have a tube put down their throat to breathe.
Now, when the Disneyland outbreak happened a couple of years ago, that was people from all across the country coming there, and they were all together. Different up in Minneapolis, where it was a big part of the Somali population. So a different epidemiological thing, right?
Sure. Yeah.
And so how do you, for the people who are here from other countries, for the Somali population, for instance, what do you tell them?
Well, number one, we tell people to vaccinate. So as you mentioned, one was an issue where someone coughed, let's say, and then multiple people were exposed to that germ.
At Disneyland.
Right,
Yeah.
At Disneyland. Whereas, in the Somali population, what we found is that 10 years ago, their measles, mumps, rubella vaccination rate was 92% in the state of Minnesota, which is pretty good. Not perfect, but really pretty good. Over 10 years, however, that declined, and it's now 42%. So less than half of Somali children in the state of Minnesota are vaccinated. And I do want to stress, as the Minnesota Department of Health has been stressing, it's not a Somali versus non-Somali problem. It's not an immigrant versus a non-immigrant problem. This is an issue purely of vaccinated versus unvaccinated kids. So what we learned happened in the past 10 years is that anti-vaccine groups sort of seized on this vulnerable population that's new to the country, may not speak the language right away, and we're having some concerns about autism, which, by the way, is based on a completely discredited report from almost 20 years ago that has not been reproduced in any proper epidemiological study. So what happened here in Minnesota is we had a pocket of unvaccinated children. Someone brought the measles in, and again, with that 90% infectious rate, multiple kids were sickened as a result of that. So what we've been doing, actually, I'm on vacation, and so for the last week, I have made 7 trips, or I'm sorry, I've done 7 talks in the Twin Cities area, as well as Rochester and Owatonna, meeting with members of the Somali community to hopefully debunk those myths and encourage them to vaccinate their children.
All right. Make sure you get your kids vaccinated. There's no evidence that it causes autism, and there's certainly some complications of the measles that you want to avoid and don't want to see your kids sick.
Right.
And finally, how can people find you on Twitter?
Uh-oh.
Because they're going to.
You don't have to answer.
No, that's fine. I have a public Twitter account. It's at NAMD4kids.
All right. Thank you so much for joining us, Dr. Ameenuddin.
Thank you for having me.
Yep.